being that it's Monday, pandemic's still going on, and apparently now has thrown itself into some sort of higher gear.
Yes, it has.
Let's spend some time with our good friend, Dr. Dennis Norem from Mercy Health, who has been our go-to expert throughout the entire pandemic. Dr. Norem, good morning to you.
Good morning to you guys.
Hopefully you had a great Thanksgiving.
Oh, I told Joe I'm still recovering. I think my stomach can't take that.
You know, when a doctor says it's all right for the rest of you.
What was the best thing on your Thanksgiving table?
Always the turkey and gravy. My wife makes great gravy. It's just nothing like it.
There's a skill set to that,
yes,
too.
There is.
Yeah, because we've all sat through more dull gravy than any of us care to admit.
Yes.
Finding someone who's got a skill for it, that's a good thing.
Good stuff.
That's a good thing. I can open up a jar with the best of them.
Good answer, too, saying whatever your wife made.
That's always a smart answer.
Great answer.
All right, Dr. Norem, what's the deal on Omicron that's got the world freaked out?
Well, it certainly freaked out the markets, didn't it, on Friday?
Yeah.
That got everyone's attention, but it appears that this is kind of what we expected, that more mutants coming our way. And it'd be interesting to see what the effect of this is. Some of the articles now coming out are saying that the disease from this variant seems to be very mild. At least that's what South Africa is reporting.
Yeah, Dr. Angelique Coetzee, who's chairwoman of the South African Medical Association, first identified the Omicron variant. Spoke to multiple media outlets over the weekend about the unusual symptoms she spotted in patients diagnosed. She said currently there's no reason for panicking as we're not seeing severely ill patients, and the symptoms she described as being very mild. Fatigue, body aches, perhaps a recurring dry cough. Many patients managed to recover on their own.
And she said no loss of taste or smell, which has been sort of the hallmark of COVID up to this point.
Right.
I would caution everyone, the average age in South Africa is much, much lower, so it's a much younger population, which you would expect not to be as sick as an older population. The other thing about the whole continent of Africa is their rate of COVID has been extremely low compared to the rest of the world. And I don't think scientists still quite understand that, given the fact that their immunization rates are very low. I think South Africa is still less than 25% immunized.
We're still way too early to know really anything about this variant, but as a doctor, I mean, we might treat it differently at the media and whatnot. But as a doctor, if you had to choose one of the two outcomes for this variant, would you choose it's a stronger variant? You know, it affects people worse, but our current immunizations are working against it, or would you prefer, or would the community prefer, you know, a less aggressive form, but our vaccines aren't very effective against it?
Oh, that's not a good choice.
Right?
Which I guess my question is, which one do you think would be more detrimental to society?
Well, I think overall we would prefer that it be less virulent. If it turns out that it causes mild disease, I think we can all live with that. That would indicate, I think, that the vaccines that we've already received are effective if this turns out to be fairly mild. And it does appear, however, from what the preliminary data shows, it's more contagious. So it probably will overtake the Delta. But again, hopefully it's a more mild disease.
And as you had pointed out, as far as the demographics in South Africa, I'm just doing a little homework on the fly as we go here. Less than 5% of people are over the age of 65 in South Africa.
Oh.
Yes, and that is a good thing for them in terms of dealing with pandemics, because younger people obviously tend to be less likely to be hospitalized.
And they also have I'm sorry to interrupt. They also have a very, very, comparatively speaking, with most of the developed world, a very low percentage as far as obesity goes. So we're not dealing with a primarily overweight, and we are dealing with a younger demographic.
And it just illustrates it's hard to compare populations, even if they seem similar. I mean, we spend a lot of time looking at Israel's data and seeming to think that would be similar to us, but there may be differences because we have obviously different populations than they do, even though their demographics may be much more similar.
With new variants popping up, maybe somebody sitting at home thinking, I'm available for my booster shot. I could get it. Should these people wait a little bit to find out if there's something different going on with their vaccines in 2 weeks, 3 weeks, so they don't get shut out of a new a booster? Well, what's your recommendation there?
Oh, absolutely not. They should get their booster. If you're eligible for your booster, get your booster. It's clear that the booster improves your defense against the virus, regardless of what variant. Now, you're right. We don't know how effective the vaccine is against this new variant. However, we'll probably know within a week or two. And I see that Moderna is already working on a booster specifically against the Omicron variant. And they think they'll have something ready early next year, probably within 60 to 90 days. But don't wait for that. The booster is very important.
After Dr. Fauci's comments over the weekend, he was hitting some of the talking head shows. Face the Nation, I think, was one that I caught him on, and doing some other things. This goes back to something we asked you a few weeks back, and it sure seems to be answering itself as time goes forward. Are we ever going to get out of this?
It's interesting. I saw that Face the Nation interview with him, and I think we're going to get out of the pandemic at some point. But I think we're going to be looking at, as we do with flu in general, we're going to be looking at a seasonal or some period of time where this is going to peak, and we're going to have to deal with it, and then it'll become less prevalent, maybe even down to the point where there are very few cases, but it's going to wax and wane. And I don't think we know yet when and how that's going to occur.
We are learning, looking around the world and right in our own mirror in a lot of cases. The lockdowns doesn't seem to be something that we're going to keep going to the well for. Some places seemingly are, but overall, it seems the world's appetite for lockdowns is gone.
Oh, I agree with you 100%. And I even saw one of the experts, a former FDA commissioner, talk about the fact that he doesn't think lockdowns are very effective. I think people all agree that the Omicron variant is here in the United States. We just haven't found it yet. They've just reported it in Canada, so it's likely here. And it's much more effective to get people vaccinated and test. And then if somebody is found to be positive, obviously quarantine that individual. But locking down a country or locking down a city probably is not very effective.
Omicron new, we've talked about identifying the Delta variant. That's not something that was done, like on-site testing, some additional testing. Same deal with the Omicron variant. We're not detecting or being able to pinpoint which variant it is until further testing after it's been sent out of the testing site?
Yes, currently that's what's going on. I heard that we are testing about 20% of our positive coronavirus specimens in this country. But with this new variant, apparently there is a mechanism that we may be able to test on site. It has to do with somehow the deletion of one of the antigens, which would make it more easily identifiable. So I think several companies, including Abbott, is working on a test that could be essentially bedside that might give you the identification that quickly. So that remains to be seen, but that probably will come out in the next month or two or three.
Going back a little bit and I guess away from Omicron and just the COVID overall, as you know, we had to go through our household and grab 3 members of it who have all since recovered. One thing I am noticing, though, with one member of our household is the fatigue that came along with COVID has hung on. It not full-blown the way it was when he was in the midst of it, but we're having some lingering effects of some pretty heavy-duty fatigue that sticks along. That's fairly normal, isn't it?
Oh, I think absolutely. We haven't talked lately about the long-haul symptoms, but certainly that's one of those long-haul symptoms. I know the other thing I've heard from some people is the brain fog. I know a person who had COVID almost a year ago, and she's stating she's finally getting better, but she said for several months she seemed to recover, but she said she just had this brain fog that followed her around. It made it difficult to remember things, and she did have some significant fatigue also.
I'm looking at a story here about the snooker championships taking place in the UK. A guy who was a 3-time world champion, one of their most charismatic players, in the chair and in the lead. He had been recovering or had recovered from having COVID, but long-lasting fatigue had been part of it. He fell asleep during the match and lost because of it, and talked about how he has had so much trouble since recovering, fighting off this sudden fatigue that would hit him.
That's interesting that it's that severe for that person. But I think we've seen this potentially with, other things, not in the scale, but over the years when people have had pretty significant flu syndromes. We talk about post-flu, and post-flu syndromes often would include somebody having fatigue for several weeks afterwards. Obviously, everybody's familiar with mononucleosis. Hallmark of mono is severe fatigue, and that could last several weeks or a few months, often when people are recovering from mono.
Speaking of the flu, I haven't heard of anybody catching the flu this year. Is this are we early in the flu season? Have you heard of any of the flu bug going around? What should we expect on that front?
Well, so far, very few cases reported. I asked the other day if any of my residents had seen any flu, and they heard that maybe there had been a couple positive results here and there, but none of them had actually seen a flu patient. So far we're not seeing flu, but it's still kind of early. We typically peak flu out right after the first of the year, so we're probably 4 to 5 weeks away from the peak of flu season, but so far we're just not seeing much.
CDC publishes a weekly update called the Weekly U.S. Influenza Surveillance Report, saying seasonal influenza activity in the U.S. remains low. Number of influenza virus detections reported by clinical and public health laboratories and the percent of patient visits for influenza-like illness has increased over the last several weeks, but not very much.
No, and that could be typical, though, for a flu season, and all of a sudden, within a couple of weeks, we could see a significant spike. But it'll be very interesting this year to see how this tracks along with the COVID.
As it stands right now, outpatient illness here in Illinois, 2.1% of visits to a healthcare provider have been for flu, which is below the normal baseline, they say, and 0.2% in long-term care facilities.
And again, very low numbers, and that's encouraging. But we probably have to get to to February, March before we can say that we've had a flu season that's been very mild.
And one more booster question for you. We'll let you go. Last week, I got a text message from CVS saying, "Hey, Joe, it's been you're now eligible for your booster shot." Is everybody getting a text, an update, a reminder that you're when you become available, or am I a lucky one from CVS for offering that perk?
I think you're the winner from CVS.
Okay, all right.
I think the pharmacies are trying to do that to promote it. But if you've gotten it, a lot of us got it through a mass clinic, and there's no reminder that way. So It's really up to the individual to look and see what the dates of their initial immunization was, and make sure that we're not. If you're at your 6 months, get it, and the sooner the better.
It's kind of like being a grown-up. You got to set the alarm clock. Mom's not going to come in and wake you up now.
Yeah, unless you went to CVS.
Right. In which case, she'll come in and wake you up.
Thanks,
now.
Ma.
Safe to assume, Dr. Norem, the next week should be an interesting one as far as news of COVID goes?
Absolutely. I think we're all waiting to see how aggressive is this new variant and how widespread is it going to be in the United States, because I'm sure within the next day or two, we're going to identify it somewhere here in this country.
Outstanding. Well, we'll look forward to once again getting together next Monday and seeing what has transpired over the previous week.
That sounds good.
Dr. Norm, thanks for your time and your expertise as always. That's our friend Dr. Dennis Norm from Mercy Health. It's 7:22. Clay and Buck are here after 11 o'clock this morning. Here's a preview.
Coming up on the Monday edition.